My dear global colleague and respected collaborator from all over the world, good morning as well as good afternoon, good evening. Me, myself, Major Dr. Mohammad Ashrafuzzaman, Associate Professor, Biomedical Engineering Department, Military Institute of Science and Technology. Herewith I am presenting with my presentation 91848 with the title Improvident Growth of Clinical Engineering in SEARO and Other Global Region. Frustrated footmark by Clinical Engineering Division, International Federation of Medical and Biological Engineering to ensure better healthcare. I am also working as the founder of Bangladesh Institute of Biomedical Engineering and Technology, SBIBMET, and the chairman of Medical Device Guideline Preparation, Director General of Drug Administration, Bangladesh, and the committee member for National Committee for Medical Device and Biosimilar Product Development. Also, I am working with several other committees for the successive development of biomedical engineering in Bangladesh and as the Chief Advisor of Clinical Engineering Association, SEARO in Bangladesh. I am happy to present here my global team, myself, and then Dr. Jitendra Sharma, who is the Managing Director and Chief Executive Officer of Andhra Pradesh Medtech Zone, India, and then Rojana Rivas-Tarajana. She is the Head of Clinical Engineering, Specialty and Faculty of Public Health, UPCH, and then George Tobekar, Engineering Supervisor and Director, WHO Collaborative Center for HTM University of Bharma, and then our respected Chair, Clinical Engineering Division, International Federation of Medical and Biological Engineering, Tom Judd. As you know, the Healthcare Technology Management and Clinical Engineering Program congresses, conferences, webinars, workshops, town halls, etc. of Clinical Engineering Division, IFMD, are encouraged to promulgate plans to take advantages of this opportunity to make every effort to reach out to eligible clinical engineers, clinical engineering technicians, clinical engineering students, biomedical engineering students, professionals at hospital and inform them the opportunity can be able from the CEDIFMB. And CEDIFMB programs and initiatives are encouraged to collaborate to identify ways to accomplish appropriate clinical engineering experts and educator for supervising of the clinical engineers or biomedical engineers, student employee to achieve the final learning outcomes of the C program. For example, as you see, just after attending myself in the third WHO Global Forum on Medical Devices in 2017 in Geneva, Switzerland, and then successively in second International Clinical and Technology Management Congress in Sao Paulo, Brazil in 2017 as a Bangladeshi. I have engaged myself for the successive development of biomedical engineering in Bangladesh. And now government has established Biomedical Engineering Institute to run the biomedical engineering program nationally, which is implementing in the college, universities, institutes, especially the polytechnic college and the universities, and then healthcare facilities. All countries of the SEARO region has adopted clinical engineering or biomedical engineering accreditation program for credentialing biomedical engineers, clinical engineers, biomedical engineering technician, and clinical engineering technician to enhance their capacities and hands-on skill on operation and maintenance of medical devices and equipments. India has been certifying their local clinical engineering, biomedical engineering graduates through Indian Biomedical Skill Development Consortium. And then in this COVID situation, so the clinical engineering division of IFMD programs are responsible for communicating the clinical engineering students, trainees, and all level experts about the right to be protected from the infection and the other options for complementing the clinical engineering practice requirement of clinical engineering program effectively. So from 2015, since the first Congress of ICEHTMC, the clinical engineering division IFMD has growth potential. And we can see in 2015, from the 20 countries, there are 40 collaborators. In 2017, from the 17 countries, almost 100 collaborators are there. And in 2020, in this COVID situation, so with the successive growth of the clinical engineering and biomedical engineering sectors, so together with CED and clinical engineering, global clinical engineering alliances, From the 110 countries, more than 250 collaborators are contributing in this CDIFMB. And now at present in 2021, from the 150 countries all over the world, more than 360 collaborators are contributing. And as you see, with the many regions are specified and divided for the training programs or the successive potential growth about the clinical engineering in these countries. The AMRO, then NAFRO, then EMRO, EURO, then SEARO, and then WBRO regions. And the collaborators from these regions, from several countries, they are contributing. And the CDIFMB has already established the global networks and successfully combating the COVID-19 with several clinical engineering training and webinars programs. Global Clinical Engineering Week, the COVID-19 newsletters are effective already and functional. So we are using the Global Clinical Engineering WhatsApp groups for our daily updates and activities. And Global Clinical Engineering blogs are there. Global Clinical Engineering partnership with the WHO are very effective. And WHO Global Clinical Engineering Alliance and Clinical Engineering Innovation 2021 innovation projects. So there are many projects there. And then the compendium of these innovations are already published. The Global Clinical Engineering Alliance are already established and effective from 2020. And then Global Clinical Engineering internship are also running from 2020 with the 3 months durations. Global Clinical Engineering Summits regularly held in 2 years intervals, so from 2015, 2017, 2019, and now in 2021. Clinical Engineering Congress, this 4 Congress has already take place, and this year it is expected to be more than 1,500 participants from more than 120 countries globally. And then we are observing the Clinical Engineering Day, and Clinical Engineering journals are also contributing in this field with the innovations, with the regulations, with the policies, and the global and national requirements and the deficiencies, as well as the scopes of improves are focused on this Global Clinical Engineering Journal. So goal of this our current global network to prepare the countries of SEARO region for developing certified clinical and engineering technician to minimize the gap between other countries, to develop and practice effective training modules to train new graduates of clinical engineering, biomedical engineering, and electromedical technicians following successive stories and check cooperation from the global clinical engineering experts. And then to adopt and practice clinical engineering certification, training, and examination process for improving and implementing clinical engineering technology management efficiently in assistance with WHO, IFMB, American College of Clinical Engineering, CRI, PAHO, Association of Advanced Medical Instrumentation, International Medical Device Regulatory Forum, International Hospital Forum, Asian Harmonization Working Party, and then Indian Biomedical Skill Consortium and other regulatory authorities to apply the collaborative mechanism for implementation of clinical engineering health technology management accreditation and certification in Bangladesh and SEARO or other region of the assistance of the clinical engineering division IFMB is strongly required, and now it is effective. So through the clinical engineering marketing approach, the possible outcomes shall be achieved. The high-level decision makers of the government and private sectors can be made cautious about the CEHTM necessity, and is important at hospitals for quality services. And the National Clinical Engineering Action Plan can be formulated easily for producing more number of clinical engineering professionals nationally and get benefits in hospitals and related facilities. Regional cooperation will be enhanced and potential outcomes shall be achieved through mutual relationship with all the clinical engineering association worldwide and with good practice and regular reporting systems. Newly established Global Clinical Engineering Alliance shall pave the way of delivering the clinical engineering HTM magnificently to its global partners, and together we all can make it better in coming days. Thank you for your kind hearing and patient hearing, and any sorts of questions or encourage from and for my regular improvement or improvement of our Bangladesh, along with Bangladesh. Thank you so much.